Hey guys, welcome back to my channel. Today we are going to talk about the mama charts, okay? Mama charts are defined or codes that's within chapter 15 of our ICD-10-CM books, all right? Let's get into it. Okay guys, well, actually I'm just going to go to chapter 15 in our book if you are a Blueprint student or my mentee. If not, just follow along because it's the easiest, it's laid out the easiest for me to kind of explain this chapter to you. First, let me say this, all right? First, let me make sure I have the page open before I lose it. But let me say this, chapter 15 or obstetric coding or mama charts, however you want to say it, this chapter, the chapter specific guidelines trumps anything else, okay? Meaning if a woman is pregnant and they go to the hospital for any type of care, it could be a traffic accident, okay? It could be asthma exacerbation. It could be anything. If this woman is pregnant, you already know your principal diagnosis will begin with the letter O. All right, that's it. The only instance where it is not is if the physician specifically documents that the pregnancy is unrelated to the current condition. In my over 25 years of experience and when I was coding, we hardly, if ever, right, receive documentation where the physician documented, excuse me guys, that the condition was unrelated to the pregnancy, all right? So therefore, 9 times out of 10, know that if that woman is pregnant, your principal diagnosis will start with a chapter 15 code. In chapter 15 codes, they all begin with the letter O, all right? So therefore, let's go on to this. I think it's important to know the trimesters, all right? So the first trimester, and I'm taking it right out the Blueprint book, all right? It's neatly laid out for you guys. Like I said, if you are a student or a mentee, open, I'm not sure, well, it's page 110 in my book, all right? But the first trimester is less than 14 weeks and 0 days, okay? That's the first trimester. Second trimester is 14 weeks, 0 days to less than 28 weeks. Third trimester is 28 weeks to delivery, all right? Then we have a postpartum. And this is all in you guys' book. The postpartum period is defined as 6 weeks following delivery, okay? So I want you guys to always remember in obstetric coding, your principal diagnosis will always start with the O. It's like I keep saying it, but remember, coding is a skill. I'm talking about inpatient coding. The more you do it, the more you know it, all right? And don't forget to collapse decades into days. You need a coach or a mentor per Warren Buffett. All right, so let's get into this coding, and I'm going through the book. So in this ICD-10 chapter, which is chapter 15 in the ICD-10-CM books, all the codes in that chapter will begin with what? Great, the letter O, okay? These codes are reported only on the maternal record, only on the mom's chart, never in the baby's chart. They would not be reported on the newborn record, okay? Codes from chapter 15 have sequence and priority over codes from all other chapters in ICD-10, all right? So for instance, all right, if that mom was in a car accident, all right, was admitted into the hospital, she was 7 months pregnant, she just say she suffered fractures, okay, horrible fractures, you still would not have another chapter code. You would not have an S code for principal diagnosis, which is our fractures. You would still have an O code, all right, in the chapter 15 chapter. And I'm not going to say that code because depending on when you see this video, the code may have changed. Just know these are chapter specific guidelines, okay? And they trump any other chapter. So we know when the trimesters begin, first, second, and third trimester, because that's going to help you also select your code, all right? Because the fourth, fifth, and sixth digits of the chapter 15 code will ask what trimester the woman was in, or the pregnancy was in, or if the woman was postpartum, all right? So when reporting a code from chapter 15, also report a code from Z3A category. This is the weeks of gestation, okay? So if the woman was 38 weeks pregnant, that's gestation. How many weeks pregnant was she? Was she 15 weeks? You will get this from the medical record. So your code, your second code or third code or wherever, but somewhere on that chart, you want to report the weeks of gestation. Also, for chapter 15 coding, you want to include the outcome of delivery. So for instance, if the woman delivered a single live born or one baby, just say she had a baby boy, Z30.0, right? Z37.0, outcome of delivery. So remember, your principal diagnoses will begin with a 0 code, all right? Your secondary diagnosis should be outcome of delivery. Was the baby born alive, right? If the baby passed away, it's stillborn. So you still want to show how did the pregnancy or the delivery, what came out of that outcome of delivery. Okay, and then you want to show the weeks of gestation. Remember, in coding, we're telling a story. So when we look at your chart, we're going to see what condition led to the delivery. Okay, maybe it was complicated, right? Maybe I'm trying to see, I can't even think. Maybe she went into the hospital and the mother was in labor, okay? And she had maybe hypertension, all right? So there is an O code for hypertension, all right? Or gestational diabetes, all right? Or whatever. And actually, if there was nothing going on with the mother, your principal diagnosis would be the letter O, 80, all right? That's if nothing was going on, all right? Also, another caveat I want to bring up is, say the mother, nothing really was going on, right? But the mother suffered or experienced a first-degree laceration, second-degree laceration, third-degree laceration during childbirth, all right? That laceration would still be principal diagnosis, even though it was not present on admission, all right? So you would want to put the laceration code, right? Diagnosis, like first-degree laceration, second-degree laceration, principal diagnosis, all right? It would still begin with the letter 0, all right? So that's the caveat really with this chapter. Principal diagnosis has to come from chapter 15, outcome of delivery, and weeks of gestation. All right. Basically, that is it. You know, it's we used to love getting moms and baby charts, okay? And I know it's different, but you have to just remember it trumps every other. The guideline is just saying it trumps any other guideline. That's it. Let me ask a couple questions here. And I'll answer them, of course, because I can't hear you guys answer, just to talk through some scenarios, okay? So remember, chapter 15 is chapter specific and takes priority when the encounter is obstetric. Use chapter 15 for the mother, not the baby. If the pregnancy is incidental, do not use obstetric complication codes. And I'll show you an example of that in a few moments. Add Z3A point. Just say if she was 38 weeks, it would be Z3A.38 to show weeks of gestation. And also remember to use the Z37.0 In this example, we're going to say she delivered a single baby, live born, Z37.0. When you go to that subcategory in the tabular, ICD-10-CM tabular, if she even had twins, all right, you still have to report the Z37 point, and then the fourth and fifth character will represent, or the fourth character if the baby was a twin, right, or a triplet. Okay, so let's see. All right, let me give you some more examples. Pre-existing type 2 diabetes complicating pregnancy would come from the the letter O 24.1 series, all right? That's pre-existing. Say the mom had diabetes before she became pregnant. Gestational diabetes mellitus in pregnancy is the letter O 24.4 series, all right? Gestational hypertension is the letter O 13 point series. Preeclampsia is the letter O 14 point series. Okay, and when I say series, it's because the categories, all right, for those codes I mentioned, it's the letter O 14, and after the point, you're going to, that's where your trimester is going to come in at, all right? When we talked about the first trimester, second trimester, third trimester, you are going to get this information out of the medical record, all right? Let's go with some examples. Scenario number 1, pregnant patient seen for a sprained ankle. Pregnancy is incidental, all right? So the physician has said the pregnancy has nothing to do with the sprained ankle. In this case, you can code the sprained ankle for principal diagnoses, and you also want to include Z33.1, saying it's just telling that the mother, the patient is pregnant, but it's incidental. They just found out, all right? It had nothing to do with the sprained ankle in this case. So, okay, example 2. Patient is admitted for uncomplicated full-term delivery. Your principal diagnosis would be the letter O80 with Z37.0 for outcome of delivery and this patient's weeks of gestation, all right? Okay, example 3. Patient has gestational diabetes in the second trimester. Listen to this. The answer is the letter O24.4 series plus the appropriate Z3A code, all right? That's her weeks of gestation. You would not, if she delivered the baby, you would have an outcome of delivery, all right? Example 4, patient has chronic hypertension that complicates pregnancy. The letter O, 10 point series, all right? This is pre-existing hypertension. It still belongs in the obstetric chapter when it complicates pregnancy. And unless the physician said it does not complicate it, we have to lead with the letter O, all right? So what is the first thing we ask? All right, is this the mother, the baby, or an incidental pregnancy? 2, what is the second thing that you should ask when you encounter these charts? Does the obstetric chapter, that's chapter 15 in ICD-10-CM, does it tell us to use a complication, combination code, or an additional Z3A, all right? Or an outcome of delivery? And it does, all right? You should always code an outcome of delivery if that mother delivered, all right? And weeks of gestation, all right? So the final rule here, chapter 15 codes lead when the encounter is obstetric. That's the caveat. That's the guideline simplified, all right? Your principal diagnoses will be an O code, all right? So I'm just going through my notes, making sure that I'm clear with you guys. But that's it. Let's do a case scenario before I let you go. So a 28-year-old patient is admitted at 40 weeks gestation in active labor, has a spontaneous vaginal delivery of a healthy single live-born male infant. The delivery is uncomplicated, no antepartum, no intrapartum, or postpartum. Antepartum, before; intrapartum, during; postpartum, after. None of those complications were documented, okay? What is the principal diagnosis? What is the outcome of delivery code? Do we need a complication code? Do we need a newborn code on the mother's record? Let's answer those questions. Principal diagnosis in that case would be the letter O, 80. Encounter for full-term uncomplicated delivery. Additional diagnosis, Z37.0. Here we go, our outcome of delivery, all right? Gestational code, how many weeks pregnant? We said she was 40 weeks. We have Z38.40. No complication code is reported because the delivery is uncomplicated. And of course, none of this is on the newborn's record. It is strictly on the mom's chart. Okay. You guys are doing good. Basically, that is it, all right? You wouldn't, with this code, would you code this on the newborn's chart? Nope. Chapter 15 is maternal codes belong on the mother's record. That's it, all right? Truly uncomplicated. So I hope this lesson has helped you guys. It is truly a chapter where the coding, once you understand the guideline, is easy. Of course, this is a skill. The more you do it, the more you learn from it, all right? Just remember, if that mother is pregnant, your principal diagnosis will be an O code, all right? That's it, and that's all. Followed by outcome of delivery, followed by weeks of gestation, and any other diagnosis code that mother may have. If she has asthma, there is an O code for asthma, followed by the chapter code, all right? If that mother even goes into respiratory failure, there is a chapter 15 code to represent a respiratory diagnosis in pregnancy. And then we would code the J96 point, say hypoxic respiratory failure, 01, all right? So just remember, in obstetric chapter 15, we will have an O code. And if there is a correlating diagnosis code in another chapter, like we just mentioned, respiratory, we will still code the respiratory diagnosis. Even if, we just said respiratory failure. So say if that mom has COPD, there is still an O code for the respiratory in pregnancy. Then we would still need to code the COPD. If it was exacerbated, it would be J44.1. However, the O code for the respiratory diagnosis, would still belong on the chart, right? So the sequencing, if you're asking, well, coach, how do I sequence that? You would just make sure the principal diagnosis is an O code, all right? And you would still list the J96.01 or the J44.1 or whatever other diagnosis the mom had. You would just have to pair it with a chapter 15 code. So I hope this helps you guys out a little bit. We'll continue to evolve in our mom's charts, chapter 15, especially as we get into the baby charts. We call them baby charts, but that is chapter 16. So if you need more help, more coaching, more guidance, of course, follow me here on the channel. And I'll actually put the link in the comments if you want to go over to my website. If you need to pick up the blueprint and you want a more structured approach to enter inpatient medical coding, I invite you to do that. But thank you for joining me today for our mama charts. I hope this helps, and leave it in the comments if you have any more questions that I can expound upon or another topic that you would like me to discuss. As always, guys, thank you for joining me today, And I'll see you at the top because the bottom is way too crowded. Bye.